we are back again. I am Dr. Grace. I am an endocrinology in training, and here with me is Dr. Hope, and a board-certified endocrinologist with more than 20 years experience. Welcome, Dr. Hope.
Thank you, Grace. Thank you, Dr. Grace.
Yes. So Dr. Hope is here with us once again, and we are going to be talking about why you need an endocrinologist and what to expect when you visit an endocrinologist. So Dr. Hope, what do you have for us today about why we truly need an endocrinologist?
Okay, thank you for that introduction. So let's start off with one of the main reasons people need an endocrinologist, and it is because of diabetes. So people with new onset diabetes can be referred to an endocrinologist because they're newly diagnosed, and an endocrinologist can help really establish what medications they need to be started on, and also involve other specialties in their care, like nutritionists. They can, refer to the nutritionist, the podiatrist, the eye doctor, but the endocrinologist can be the one that puts everything together and really starts out the basic regimen needed for their diabetes. So that's one. The other thing is diabetics that are maybe referred back later on, but then their diabetes is getting worse again. So that's another reason to refer to an endocrinologist. The patients may be on oral medications, and they may need insulin. So at that point, it's good to refer to the endocrinologist for further evaluation and treatment. So besides diabetes, there are many other reasons to refer to an endocrinologist. The other reason is patients with thyroid disease. So the thyroid, as we talked about before, is a gland in the neck, and it controls your metabolism. It's one of the hormones that actually controls your metabolism. So how active or how slow your body is. And so an overactive thyroid is definitely a reason to refer to an endocrinologist, even an underactive thyroid initially. But later on, so too much thyroid hormone or too little thyroid hormone. The other reason is thyroid cancer. So thyroid cancer, believe it or not, is not that uncommon. And sometimes people are initially diagnosed with thyroid cancer, or they may have thyroid nodules and need to be evaluated to see if they actually have thyroid cancer or not. So thyroid nodules and thyroid cancer are other reasons to refer to an endocrinologist. Other reasons.
So you mean like the nodules can be like any kind of lump they feel in their neck, or do they sometimes feel it? Because sometimes they'll come to the clinic and they are not even aware that they have the nodule.
Exactly. So sometimes a person may come to their doctor and they may have an obvious growth in their neck. Sometimes it's large and they may have difficulty breathing or difficulty swallowing. But there are other times that they may not identify it themselves at all, and maybe the doctor may identify it on their physical exam, or even notice that there's a slight enlargement in their neck that the patient may not recognize. So yes, the person or patient may identify themselves or not, and it may be identified by their primary care doctor.
Awesome. Okay.
And sometimes it's even identified on so if the person may have a neck CT for another reason, a CAT scan, right? Or even an X-ray sometimes, a chest X-ray, sometimes you see the enlargement. So for other reasons, it may be identified, and then an endocrinologist has to do further investigation.
Great. All right. And are there other reasons?
Yes. So other reasons to refer to an endocrinologist are disorders involving the pituitary gland. So the pituitary gland is a gland in your brain that controls different hormones. So the thyroid actually is one of those hormones, but then some of the reproductive hormones are controlled by the pituitary gland. So there's a hormone that uh, secretes or makes prolactin that can decrease the amount of reproductive hormone you have. So it's called FSH. It can decrease the amount of FSH or LH, which are hormones that control the release of estrogen and testosterone, which are the female and male hormones. The prolactin itself is a hormone that can cause you to release breast milk when you're not pregnant. So,
if the body is having some breast milk discharge when they are not pregnant, it is not a good thing.
exactly.
And that they need to see an endocrinologist for.
Exactly. And they may be coupled with headaches as well, or difficulty with their peripheral vision. So sometimes those are some of the ways to know that you have a disorder involving the pituitary gland. Also, something called growth hormone can be affected, also released from the pituitary gland. So, what does that cause? That causes people, if you're before before adulthood, if you have excess growth hormone, you can grow very tall. But after adulthood, if you have excess growth hormone, you can develop big hands, the face can become bigger. So sometimes one of the ways we identify it is like by changing your ring size or shoe size, because as an adult, your shoe size usually doesn't change. But if you notice that your shoe size changes as an adult, that's one of the ways to identify excess growth hormone. So that's another reason to refer to an endocrinologist.
Yeah, so I can see that there are lots of reasons to refer to endocrinologists. And we're going to talk more about this in detail in our subsequent videos. So stay with us, follow us on Instagram, on Facebook, TikTok, and just check on Ask Endocrinologist, and we will tell you more, and we will be more open to your questions and able to answer any questions or concerns that you have. Thank you, Dr. Hope. So let's go to the second part, which is what to expect at an endocrinologist visit.
Okay, so when you go to an endocrinologist, one thing you can expect is that they would need blood work. So, in order to identify what's going on with these hormones, we need blood work. So, that's one of the fields that we really use the blood work to give us the answers on whether you have too much or too little of the hormones. And, we need, usually the blood work is done ahead of time. And if you're referred or if it's a follow up, we may actually add additional tests in addition to the ones that your primary or referring doctor had recommended or ordered. Another reason is one of the things actually that you can expect is as a diabetic, we want to see those finger sticks. So if you come to an endocrinologist's office, bring them a list of your blood sugars. So usually at least a logbook. Yes, we need to see blood sugars. So we can help you better when we know not only the average blood sugars, which is something called a hemoglobin A1C that is done before your visit, but we need to see the blood sugars at different times of the day. And the only way we can identify that is by actually looking at your finger stick. So the other thing that you can expect is that sometimes the endocrinologists themselves will get a finger stick. So they will prick your finger and just see what your blood sugars are on that day. But that gives us an idea of what's happening that day, but we also need the overall picture. So expect that we will be asking you for that information as a diabetic. The other thing is we usually ask like about your diet, if again for patients with diabetes or patients who are overweight and come to the endocrinologist to help with their weight control. We ask like a list of what you've eaten over the last week, or what's your eating pattern like. So if you have a food diary, like write down what you've eaten so you can remember to tell the endocrinologist, and not only what you've eaten, but the portion of what you've eaten, how much, the amount is key in helping
Portion
to
control.
portion control. So that's very important in helping us to help you better.
Yeah, yeah. So, which is great. We're going to talk more as well about what to eat, kind of food to eat. If you have any medical conditions related to diabetes and all this, so we will be able to guide you through. Thank you so much, Dr. Hope. I believe that at this stage, if you need to see an endocrinologist from what we have talked about, you should not hesitate to go knock on their door. Ask your primary care doctor and see how you can get an endocrinologist to see you for your hormone-related condition. And we are here every Saturday, and we will be telling you more about many hormone-related conditions. And till then, stay tuned and follow us on all the different social media. Same name, Ask Endocrinologist. Subscribe and share with your friends.
Thank you.
So, next time, Dr. Hope. Thank you for having us today.
Thank you for having me.